Hello guys, you want to meet tetanus? Let's go.
Tetanus is an acute disease characterized by the skeletal muscle spasm can be there and autonomic nervous disturbances can be noted. And tetanus was caused by Clostridium tetani. Okay, and what are Clostridium tetani? And its incubation period was ranging from 6 to 10 days. Okay, let's learn what is the characteristic features of Clostridium tetani. Clostridium tetani is an obligate anaerobe and it was a gram-positive bacilli. Okay, gram-positive bacilli and terminal round spore can be present and it is appear as drumstick appearance can be noted. Okay, let's learn about the virulence factor. It has two exotoxins. There are two exotoxins are there, tetanospasmin and tetanolysin. Okay, tetanolysin is in a hemolysin, so there is no role in the tetanus when there is a tetanospasmin. What is a tetanospasm? Tetanospasm is a neurotoxic antigen. Okay, tetanospasm is a neurotoxic antigen, and it was encoded by plasmid. Okay, and it was neutralized by tetanospasmin is neutralized by antitoxin. Okay, next. What is the mode of the transmission of tetanus? It is, you can use the number SONI, surgery, otitis media, neonatal tetanus, and injury. And the most common form is injury. Okay, when a surgery done in a septic condition, and it can lead to the tetanus. Okay, and commonly neonatal tetanus is associated with the 8th day of the disease. It also known as 8th day disease. Why it is called? After the 1 week of delivery, there is a presentation of neonatal tetanus at the 8th day. So it is a characteristic and the most important feature of the neonatal tetanus that there is a delivery in septic condition. It lead to neonatal tetanus. Okay. Next, and what is the mechanism? What is the mechanism of the tetanus? Here, this is an tetanus toxin, and after the internalization of the mode of transmission, after they get internalized into the body, this tetanus toxin go and bind to the polygangliocyte receptor on the motor end plate, and after binding they get internalized and they transfer into the retrograde manner then reach to the nerves, the neurons which produce the glycine and GABA are the inhibitory neuron type. Okay, and it releases so that the contraction can be released when there is an inhibition, so they release the inhibitory, they inhibit the neurotransmitters so that they increase in a signaling strength, thereby the severe contractions can be taken. So this is the manifestation of the tetanus. Okay, let's learn about the clinical features. The first symptom of the tetanus is trismus or lockjaw. Here the masseter tone is increased. It is one of the most first and clinical feature first noted can be known as trismus, and lockjaw can be presented. There is a contraction, there is a facial contraction, facial muscle contractions can be seen. Okay, next, neonates, we can observe the neonates he has difficulty in feeding. Okay, next, what is the progress of the disease? The progress of the disease can be localized, generalized. In localized, wherever it is affected and pertaining to the limb, and it was presented at that limb only. Okay, in generalized condition, painful muscular spasm lead to the descending spastic paralysis. What are this complication? Complication is you can use the mnemonic ROM. It's a rhizus sardonicus, opisthotronous position, and respiratory muscle spasm can be seen. Okay, in rhizus sardonicus, abnormal sustained spasm of the facial muscles can be seen. It's called appear as grinning. Rhizus sardonicus, also known as grinning, can be seen. Okay, this is the lockjaw. This is the case of lockjaw, and this is the opisthotronous position. So in this opisthotronous position, abnormal extensor surface muscles are contracted. So like this, an arch can be seen. This is the opisthotronous position. Okay, next, hands and feet are spayed. Okay, in the deep tendon reflexes are exaggerated. Okay. Next, what is the lab diagnosis? Lab diagnosis can be noted by means this specimen. You need to excise. You need to remove the tissue from the necrotic depths of the wound. Okay. Next, gram staining, you got the gram positive bacilli and the drumstick appearance can be noted. And what is the culture you need to do? In RCM, meat produce black color colonies, and along with the foul smell can be noted. When you use the blood agar with the polymyxin and incubated at 37 degree 24 to 48 hours in an aerobic condition, you can see that swarming growth can be seen. And what is the treatment, sir? In treatment, there is a metronidazole is a drug of choice, and there is a two preparation called as HTIG and ATs. HTIG means human tetanus immunoglobulin and anti-tetanus serum immunes. And what is the dosage to be given? Dosage in the HTIG, you can give the 250 international units. When in anti-tetanus serum, you can use the 1500 international units can be seen or can be given. Okay, in combined immunization schedule, you can use the tetanus toxide along with, you can use either DPT or pentavalent or TD, or you can use the HTIG or AAG can complete. These should be one, and this should be the one, and this should be the one, and it's independent of choice. If we need to prevent prevention of treatment after an injury, this is one of the most important table and most asked in the NEET PG as well. See, if an injury is occurred, okay, is tetanus prone or not prone to tetanus? If it is not prone to tetanus wound, if you taken the tetanus vaccine within the first 5 years, in the 5 years, then nothing required. In the case of the prone to tetanus wound also, if you taken tetanus vaccine more than 5 years or 10 years ho gaya, then you can take only TD1 dose, and after 10 years also you can use the TD1. If an information you don't know about the unknown incomplete immunization schedule, you can use the TD complete dose can be given. When in tetanus prone individual, in more than 5 years to 10 years, you can use the TD1 dose. More than 10 years, you can use the TD1 plus HTIG can be given. If unknown or incomplete, you can use the TD plus complete HTIG can be given.